and welcome back to another video of Medic Notes. This video will be on adenomyosis. It is a condition where there is ingrowth of the endometrium, which includes both the glandular and stromal components, directly to the myometrium. It coexists with other conditions associated with hyperestrogenic state, such as uterine fibroids, endometrial hyperplasia, endometrial carcinoma, and also endometriosis. This adenomyosis usually affects the body of the uterus, and it is rarely seen in the cervix. It is most commonly seen among multiparous women, beginning in their late 30s until menopause age. The picture shows a healthy uterus versus a uterus with adenomyosis. The causes of adenomyosis is still unknown. However, there are theories suggesting that it is due to downgrowth of the basal endometrium into the subendometrial myometrium, which is demonstrated by some communications between the glands inside the myometrium and the endometrium. And adenomyosis might be related to multiple childbirths or vigorous curettage. For clinical features, the individual may be asymptomatic, where the adenomyosis is diagnosed on a hysterectomy specimen, which was done for a different indication. Other signs and symptoms include increasing severe menorrhagia, which is seen in around 70% of the cases. This menorrhagia is due to an increase in surface area due to enlarged uterus, or due to increased vascularity to support the enlarged uterus, or impaired contraction due to glandular tissue in the myometrium. And there is also possible association with endometrial hyperplasia. Other signs and symptoms include dysmenorrhea, where there is painful menstruation. Dyspareunia may be present, where there is pain on sexual intercourse. Frequency of urination due to pressure symptoms. And also a bearing down feeling together with abdominal cramps. And it is important to remember that the symptoms may overlap with endometriosis, which is another condition within the uterus. For physical examination, there may be no mass palpable on abdominal examination. Asymmetrical uterine enlargement, in case there is a large adenomyoma. There may be tenderness on bimanual palpation. The findings may vary due to associated fibroid or endometriosis. For investigations, can do full blood count to look at the hemoglobin level in cases of excessive bleeding. There might be anemia. Pelvic ultrasound, where these are some of the expected findings, such as uterine enlargement, asymmetrical enlargement of anterior or posterior myometrial wall, where posterior wall is more commonly involved. Heterogeneous echogenicity, where there is presence of cystic glands among the smooth muscles. Hypoechoic myometrium, with multiple small cysts in the myometrium, increased vascularity within myometrium, and also echogenic nodules or linear striations radiating out from the endometrium into the myometrium. These are some of the signs that suggest adenomyosis. Other investigations include hysterosalpingography and also MRI scan to look for a distorted endometrial junction. For management, it can be divided into medical or surgical management. For medical management, we manage the symptoms, such as dysmenorrhea. We can give NSAIDs or mefenamic acid to reduce the pain. Menorrhagia, to give tranexamic acid to reduce the heavy bleeding. And also suppression of menstruation by giving these hormonal drugs. Whereas for surgical treatment, conservative surgery is for young women who still desire for further childbirth. So such as wedge resection for localized disease, endometrial ablation reserved for those with heavy menstrual bleeding, and also uterine artery embolization. Whereas for non-conservative surgery, there is hysterectomy, which is actually the definitive treatment. And hysterectomy is indicated in older women who have completed their family and does not desire for any more childbirth. That is all for this video. Thank you.